Hello, it's a pleasure to be discussing the NeuroFrailty project as a case study of neurology research in Lancashire. My name is Dr. Jasmine Wall. I'm an academic clinical fellow in neurology, which means that I'm a neurology doctor in my 12th year of training, and 1 day per week of my time is dedicated to research. For the past year, I've been developing the NeuroFrailty study. During this talk, I'll explain the motives of the study, the importance of the NeuroFrailty study to Lancashire, and explore the critical elements of the local research environment which make this study possible. The NeuroFrailty study aims to understand why people develop seizures after the age of 40. We know that these people are at increased risk of stroke and dementia. What we do not know is whether this risk is preventable. We'll investigate people who develop seizures and also people who do not develop seizures, looking for differences in modifiable risk factors for stroke and dementia. If we can identify why these people go on to develop these catastrophic diseases of stroke and dementia, we may be able to prevent it from happening to them. Prevention of neurological disease has always been my research interest. There's no better thing than a stroke which does not happen. There are some key people in the university and NHS which make this kind of neurological research possible. Prof Emsley, who holds an academic professorship and clinical position, whose work in cerebrovascular research drew me to Lancashire. Prof Knight, who is a health statistician at the Centre for Health Innovation and Statistics at Lancaster University. The Research Development Service at Lancaster University, which is one of only 11 in the country, and facilitated collaboration with researchers at the University of Manchester and the Universities of Liverpool, alongside providing funding assistance. The team at Lancashire Clinical Research Facility have been a linchpin to the process of gaining ethical approval and establishing governance and local protocol. The partnership between university and hospital has made it possible to envision a project where the governance and IT technology is in place to ensure that data collection can operate within the NHS, data analysis can benefit from the technology and expertise of the university. Why perform this kind of research in Lancashire? 26% of the areas in Lancashire are in the bottom decile for health outcomes. Blackpool, which is in the catchment area of Preston's Neurology Tertiary Service, is the lowest ranked area in the country for health outcomes. It is also one of the highest prevalence areas for people living with stroke in the UK. As a general rule, the place with the greatest health burden is the place with the greatest potential for change. Research must happen at the place of the problem. This is the reason that the NHR research strategy priorities include bringing clinical and applied research to underserved regions and communities with major health needs, and embedding equality, diversity and inclusion across the NHR's research, systems and culture. The UK needs research into preventing disabling disease, and that research needs to happen in the places those diseases happen. This makes Lancashire an important place to study disease prevention. Will the NeuroFrailty study be successful? On paper, things look encouraging. Important research into preventable, serious diseases, taking place in the part of the country where these diseases are prevalent, with a university with a good track record of neurology research and a hospital with excellent research resources. This study is also likely to yield research papers which lead to a change in practice around the care of late onset seizures and to receive attention from relevant charities and patient groups. Thinking more broadly, though, about the success of this research, there is the potential to develop the infrastructure that leads to long-term outcomes and thereby attracting other researchers and research funding in cerebrovascular disease in the area. The long-term success of this study will not only be determined by its 3-year outcome, but the potential to develop and extend the study, producing long-term outcomes and long-term opportunity to change clinical practice. Developing long-term research outcomes depends upon sustainable research structures. We need to see sustainable commitment by the university and NHS to the necessary resources and career opportunities to support a long-term project seeking to prevent disabling neurological disease. There is good potential for the NeuroFrailty study to improve the infrastructure for epidemiological neurology research in Lancashire and develop these long-term outcomes, and I look forward to seeing this come to fruition in coming years.